Hi everyone, this is Anna from nursestudy.net, and we're going to go ahead and go over some acute pain nursing care plans.
This website is not intended to provide medical advice. The articles on this website are intended for entertainment or educational value only. While we strive to offer 100% accuracy, medical procedures are rapidly changing, and laws vary greatly from location.
Acute pain is an experience that is known to virtually all human beings. It is an unpleasant feeling that can be described as highly suggestive as the person experiences it. As a nursing diagnosis, acute pain is defined as an unpleasant emotional or sensory experience resulting from an actual or potential damage of a body tissue. It can be sudden or slow onset of any intensity, ranging from mild to severe, and can be experienced for a few seconds up to 6 months. Chronic pain, on the other hand, is defined as pain that lasts longer than 6 months. The following nursing care plans can help a nurse to provide efficient, excellent care for a patient with acute pain. So for our first nursing care plan, the nursing diagnosis would be acute pain related to hip fracture secondary to fall, as evidenced by pain score of 10 out of 10, guarding sign to the affective limb, restlessness, and irritability. For our desired outcome, we would say the patient will report a pain score of 0 out of 10. Intervention. Assess the patient's vital signs. Ask the patient to rate the pain from 0 to 10 and describe the pain he or she is experiencing. Rationale. To create a baseline set of observations for the patient. The 10-point pain scale is a globally recognized pain rating tool that is both accurate and effective. Intervention. Administer analgesic pain medications as prescribed. Rationale. To provide pain relief to the patient. Intervention. Ask the patient to re-rate his or her acute pain 30 minutes to an hour after administering the analgesic. Rationale. To assess the effectiveness of this treatment. Intervention. Provide more analgesics at recommended or prescribed intervals. Rationale. To promote pain relief and patient comfort without risk of overdose. Intervention. Reposition the patient in his or her comfortable preferred position. Encourage pursed-lip breathing and deep breathing exercises. Rationale. To promote optimal patient comfort and reduce anxiety and restlessness. Intervention. Refer the patient to a pain specialist if ordered by the medical provider. Rationale. To enable the patient to receive more information and specialized care in pain management if needed. Nursing diagnosis. Deficient knowledge related to acute pain management as evidenced by patient's verbalization of, "I want to know more about how to relieve my pain." Desired outcome. At the end of the health teaching session, the patient will be able to demonstrate sufficient knowledge of his or her acute pain and its management. Intervention. Assess the patient's readiness to learn misconceptions and blocks to learning, like denial of diagnosis and poor lifestyle habits. Rationale. To address the patient's cognition and mental status towards pain management and to help the patient overcome blocks to learning. Intervention. Explain what his or her pain management program entails, like medication, relaxing techniques, related physiotherapy, or exercises. Avoid using medical jargons and please explain in layman terms. Rationale. To provide information on his or her pain management program. Intervention. Explain to the patient the details of the prescribed medications, like the drug class use, benefits, side effects, and risks to treat the acute pain. Ask the patient to repeat or demonstrate the self-administration's details to you. Rationale. To inform the patient of each prescribed drug and to ensure that the patient fully understands the purpose, possible side effects, adverse events, and self-administrated details. Intervention. Educate the patient about non-pharmacological methods for acute pain, such as imagery distraction techniques, recommended exercises, and relaxation techniques. Rationale. To reduce stress and to promote optimal pain relief without too much dependence on pharmacological means. This is Nurse Anna, and this concludes our acute pain nursing care plans. We have several more acute pain nursing care plans at nursestudy.net, so please visit us there and just type in acute pain and the other care plans will also come up. So for more care plans, practice exams, and study guides, visit us at nursestudy.net.